Hello, I'm Scott Bagnell, manager of the EMS department. Let me invite you into our hospital and I will walk you through our screening process so that you are aware of what's going to happen when you do come to the ER. So come on in. So when you arrive, you're going to see the phone and some directions. Pick up the phone, dial the number, and you're going to be asked questions such as temperature, cough, fever, have you been around anybody with COVID, have you been around anybody with flu? If you say no and it screens negative, you'll come through the door, they will take your temperature, and then they will direct you to whichever department that you're supposed to be going to. If you do screen positive or your temperature is elevated, we're going to take you out of this area. You won't enter the ER through here, and you will come in through our isolation unit. So let me walk you through that one. You will be met by one of our staff members who will be gowned up, and we will enter through this tent. As you come through the tent, you will see that we have what's called a HEPA filter system that actually draws air out of the hospital through a big filter and then exhausts out into the atmosphere around us. We've got a chair set up to where you can get your coat off because it is going to be kind of warm when you walk in there. And then once we have you prepped, we will come through this door. Okay, so once we have you ready to go, we will go through our decontamination room, and we actually have a bed set up. The whole area now is negative pressurized when we turn on the fan that we talked about a moment ago. So everything that's in these three rooms that are isolation rooms is actually drawn out, and none of the air that's in our three rooms is allowed back into the hospital itself. It all exits through here. So come on in. So this will be our first isolation room that you will come to. Now, depending on number of patients that we have, we will move you from this room to one of our other rooms. And this way we can actually treat 3 patients at a time. We have one person who is deemed this is their area, so they will be in full isolation garb, and they will begin treatment for you. The person who walked you in will actually exit the room, and they will go to decontamination as well. So I will pass you now to your ER nurse, who is June Minchow today.
Hi, as Scott said, I'm June Minchow. I'm the director of the emergency department. As you can see, things have changed in our emergency room. We have put up special isolation walls and barriers for your safety and for the safety of our staff. I'm here with Dr. Aaron Billen this morning. Dr. Billen is the medical director of our emergency department. And so we're going to just walk you through what our emergency department looks like for you right now. As Scott said, we have one room in here that you first enter after being in the HEPA filtered rooms. We've been assured by our facilities department that HEPA machine will filter 1,200 square feet. And so the 3 rooms that we have cordoned off are totally safe for having that virus pulled out of those rooms and exited to the outside through a multitude of filters.
One thing people need to realize is we're going to be doing things a little bit differently. We're going to try, people who likely have the symptoms suspicious for COVID-19, we're trying to minimize the contact that they have with the staff and other people in the hospital. So it may take a little bit longer, we may do things a little bit differently than you're used to, but be assured it's for your safety and for the public safety.
As Scott said, we've got everything blocked off in 3 of our rooms. However, we're still seeing patients who are not testing COVID positive in our regular emergency department. So when you come in, you'll still be screened for all of the COVID symptoms: shortness of breath, difficulty breathing, sore throat, all of those fever, all of those things that we normally look for. And if you screen negative for those, you'll be triaged in our regular manner, and then you'll be brought back through our emergency department. As you can see, we're still open for business for all of those patients who are in need of our services. You still have heart attacks and broken legs that happen out there, and we want to see you for those.